Good afternoon, everybody. I'm Morgana Galardi, a PhD student in veterinary science and fellow researcher at the National Reference Center for Animal-Assisted Interventions in Padova. Today I will present you National Guidelines for Animal-Assisted Interventions in Italy, one welfare applied to legislation. In this presentation, I will explain how the Italian legislation on animal-assisted intervention is a good example of a practical application of the One Welfare framework. First of all, I will introduce you the national guidelines themselves. Then, I will explain how they regulate in theory and practice the key parts of animal-assisted interventions in Italy, with particular attention to the role of the veterinarian in ensuring animal welfare, to the specific settlements of the multidisciplinary team that provides the intervention, and to the characteristics of the facilities. In the last part, I will describe how all these features of the Italian law are coherent with One Welfare claims on animal-assisted interventions. Starting from the beginning, Italian guidelines for animal-assisted interventions were established in 2015 to regulate all these practices which have spread in Italy over the past 20 years. They were developed by the Italian Ministry of Health. Unlike other European countries, in Italy, the Ministry of Health has in charge both human and veterinary medicine, applying a One Health approach at an institutional level. The aim of the guidelines are define operational standards for correct and uniform implementation of the field, identify tasks and responsibilities of the professional dealing with animal-assisted interventions, specify theoretical and practical training conditions, provide for a clear division of responsibilities, and guarantee attention to both people and animals in the setting. All these purposes were written having in mind a theoretical background that can be resumed in 5 pillars: application of the biopsychosocial model, application of the diamond model on the setting with a multidisciplinary approach, animal welfare as a key issues for the quality of animal-assisted interventions programs, standardized training programs for animal-assisted intervention staff, and a strong ethical framework in an animal-assisted interventions program design addressed to a holistic taking charge of the patients. All the practical rules listed in the national guidelines came from this base. First of all, the guidelines define animal-assisted interventions as interventions with therapeutic, educational and recreational goals, with the involvement of pet animals. Moreover, they are addressed mainly to people with physical, neuromotor, mental and psychological disorders, but also to healthy people. Depending on the areas of activity, a distinction is drawn between 3 types of animal-assisted interventions: therapy, education and activity. All of them are followed by the clarification of the characteristic of each type of intervention. Thinking about One Welfare framework, some aspects regulated by the guidelines have to be particularly pointed out. For example, the role of the veterinarian in ensuring animal welfare, the composition of the multidisciplinary team, and the strong attention to the characteristics of the facilities. Regarding the role of the veterinarian, it is essential to guarantee animals' welfare as well as user safety during animal-assisted interventions. The veterinarian have to attend the specific training courses to gain the expertise. The involvement of animals in interventions could be stressful for them because it can be considered as a working activity. The veterinarian is responsible for the health and behavioral examination and of the monitoring of the animals involved, pushing providers to a positive welfare vision that goes beyond the 5 freedoms and encompasses the 5 domains model by considering animals' attitude and motivation to cooperate with humans. According to this issue, the accurate assessment and selection of animals involved are crucial, so the vet has to make a prior assessment via clinical and behavioral visits, monitor the animal's conditions during sessions, monitor the animal's condition in periods of inactivity. Moreover, the correct implementation of animal-assisted intervention projects needs the involvement of a multidisciplinary team to effectively manage the complexity of the human-animal relationship and to make it beneficial for the both sides. The Italian guidelines provide definitions of the different professional figures and the qualifications required, as well as the educational programs to obtain the certification of competence. In particular, in animal-assisted therapy and education, which are the most complex type of interventions, the team should always include the project manager, that have the responsibility of the planning of the intervention and decides the objectives and the methods. The above-mentioned veterinarian, who selected and evaluates the animals to involve, and the present in the setting of the two figures, the animal handler, in charge of the animal, and the intervention manager, who has in charge the user and is a person with a specific background in the ethical field for therapies or in the educational field for education. All these properly trained people guarantee the good outcome of the intervention and the respect of the human and animal welfare. Furthermore, the attention to the framework of the interventions complete the picture, thanks to a holistic way of thinking and taking care of others. Indeed, in the national guidelines, there is a section dedicated to the setting of animal-assisted interventions. The facility used have to guarantee health protection and safety of both clients and animals through structural and management requirements. The guidelines establish some structural requirements, like the presence of a waiting room for users and their caregivers, and separate entrances for users and animal in the intervention setting. Moreover, some management requirements are also mandatory, like safety and hygienic procedures for everyday activities and emergency procedures. In case of animals housed in the Animal-Assisted Intervention Center, it's mandatory to have suitable areas according to the neurological and physiological needs of the animal species, and a suitable number of people who take care of the animals. It's clear our pillars came under the larger umbrella of the One Welfare framework, highlighting the need to ensure a holistic taking care approach addressed to users and animals through a multidisciplinary vision. In the guidelines is established that professionals with specific qualifications and training collaborate to achieve the goal of the animal-assisted intervention program, in a setting that must meet specific requirements to be recognized as appropriate for the intervention. In detail, there are most of the statements that have to be included in animal-assisted programs aligned with the One Welfare approach. Indeed, guidelines guarantee the description of aims and activities through the planning made by the project manager. The animal-assisted program is developed providing procedures that match human, animals, and the environment to maximize benefits for all. The welfare and safety of both animals and humans are guaranteed thanks to the competence of human healthcare and animal professionals involved in the multidisciplinary team required by the Italian guidelines, and at the same time the collaborative networks are provided. In conclusion, when applied to legislation, One Welfare ensures safety during animal-assisted intervention. A One Welfare approach is mandatory to regulate animal-assisted intervention, and Italian guidelines are a practical example of One Welfare application at a legislative level in Europe. The Italian model so could be an example of multidisciplinary approach to animal-assisted intervention. I hope that this presentation was of your interest, and thanks for your attention, and if you have any question I will be happy to answer them, and I also leave you my contacts if you have further questions in the future.